Thank you for being here today. Let's start off with thankful for the weather. It was beautiful last night. A lot of people were out walking, getting outside, which I know is very needed right now. Going outside is not banned, so continue to do that when you can. I want to kick off our press time today with, I'm just going to get right into some very important information. Today, we are providing a notice to our Board of Health to convene a meeting tomorrow at 2 o'clock. And at that meeting at 2 o'clock, my administration will be bringing forward a recommendation to that board to consider an ordinance that would include the following. We would be limiting gatherings to 10 or less for all the businesses listed in the governor's executive order, all the business categories. We will also be asking that that ordinance is enforceable by law as a Class 2 misdemeanor for violating that. So let me just tell you what this means. As of today, we are not going to be mandating business closures in the city of Sioux Falls, but we are going to be recommending a mandate that would limit 10 people, 10 patrons or less in any business. So it's a very strict ordinance. We're not saying you can't close or you can't be open, but we are saying you can only have 10 patrons. So that is certainly going to clear up a lot of the challenges we're seeing by some of the businesses that aren't wanting to operate in the fashion that we've encouraged them to take. Let me unpack why we're taking this approach. We want to continue to show unity with the state and operate within the confines of the executive order that the governor has issued to us as municipalities. This measure will also help alleviate questions and concerns people are expressing to us at this time. When and why are we going to do this, and how will it be enforced, and so forth. I want to make one thing crystal clear today, and that is that we are operating right now as a city to the fullest extent we are able to under law. We're absolutely operating to the fullest extent under law. We want to do a couple things. We want to operate under that EO that we've been provided with from the governor's office, and we want to comply with that. We want to protect public safety and public health in our city. And third, we want to protect the taxpayers from potential litigation that could be come forward as a result of unwarranted or government overreach, for lack of a better term. And so we continue to operate under the fullest extent that we are able to under law. And so I want to make sure everyone is very, very clear on that. Those businesses that are listed in the GovEO that will have to abide by this ordinance, should it be passed by our Board of Health onto our City Council, who will then be convening at 4 o'clock tomorrow to be encouraged to put this in action, would be bars, restaurants, breweries, cafes, casinos, coffee shops, recreational or athletic facilities, health clubs, or entertainment venues. That is from item 13 of the GovEO, and we are going to be following that. I am having a lot of questions and comments about salons. Salons are not part of this EO. I would just like to specifically call out salons and salon owners, stylists, people who work in salons. If you don't feel that there's a safe environment for you to perform your craft in a salon, a massage parlor, anything like that right now, you need to make that known to your employer, and you need to make a decision that's best for you. Because your business, most salons don't have, even if we included them in here, don't have 10 or more people at a time typically in those. And so this does not apply to salons, so that's a separate category. Those business owners have to continue to operate with the safety of their employees and their patrons in mind. I want to specifically thank Senator Rounds and Senator Thune, both who have reached out to me several times during this process. And we have a Senate bill, or we have a bill that the Senate will be considering today. I assume it will just be passed through without hopefully any debate or amendments. That will be one of the largest stimulus bills in the history of our country. That's being called a wartime stimulus package. And it will provide some very swift relief and some great relief that is needed to our business community and to those affected by that. Small business owners and families, help is coming from the feds, and we continue to do what we can within the city to help as well. I want to also reinforce that there are jobs out there right now. There are employers. I've never seen Hy-Vee, Walmart running ads on TV saying, we need temporary help right now. We need people. So people who are displaced from their work, finding themselves without a paycheck, there are jobs available. Please look at some of those options in addition to these assistance. There's ways to get to work right now as well. We set up a One Sioux Falls fund about a week ago. And as of last night, we have over 1,000 requests into that fund for rental and housing assistance. Quite honestly, they're coming in at it's an unsustainable rate for the size of that fund right now. So focuses on that continue to be growing the fund. The fund will supplement some of the gaps or fill in some of the gaps that Fed dollars won't be able to fill in, but we're continuing to try and grow that fund and get more support for that fund. So this is my call to action to business owners, leaders in the community who, if you find yourself in a situation where you have dollars that you feel that you can put towards this fund, I need your help with that fund. And so please consider that. Our Unmet Needs Committee did meet, though, and we are going to be funding first round of 120 families in our area who are struggling because of COVID are going to be getting financial relief this week already from the fund. So it's already going to work just a week after it was put into place, which is really great to see. I want to also address federal language or federal talking points that we've all seen a lot about being open by Easter, full churches on Easter, economy needs to come back, let's get it going. And listen, I love optimism. I'm the most optimistic guy I know, but I'm also a realist, and I want to be very real that this is going to take a while for our economy to recover. And so we are doing all we can to ensure we don't collapse the economy in our city, but we're also doing all we can to ensure public health in our city. All right? And public health, as we've said all along, is priority number one in this. And so I want to be very realistic about open by Easter or 2 weeks back to normal. I'm going to say that's very unlikely. Okay? So you need to, I think, listen to some of your state and local leaders on this who are giving probably a more realistic picture of what we'll be facing in the weeks and months ahead, and that's why providing dollars to the One Sioux Falls Fund, the stimulus dollars from the Fed, so forth, are going to be so important because we're going to need to sustain some support for the next several months for sure. So lastly, for a call to action today, I want to talk about self-health. I've talked about this before. It's a topic I'm very passionate about. There is a lot of anxiety in our community. There is a lot of mental health issues that are bubbling up in our community. 211 is taking more of those calls than normal, not only from business owners who are not sure how they're going to make it through this, but from laid off and furloughed employees that aren't sure how they're going to make it through this. I need you to talk to someone if you're experiencing those challenges. I need you to talk to a friend, a pastor, clergy. My email is mayor@siouxfalls.org. You can email me, and I'll line you up with someone who I know would love to talk with you. I need you to take care of yourself right now because it's very important. I need you to know that there's a whole army of people that are here to support you throughout this time. So we'll get through this together. A phrase I adopted and I'm starting to say more is by distancing ourselves, we'll stick together. And that's kind of a theme right now. It's by staying apart, we will stick together. And that's what we have to do right now. So I'm going to turn it over to Jill Franken with Public Health for some additional updates.
Thanks, Mayor. Yesterday we met with the Board of Health, and we provided them with a situation update as well as some additional information about what we would be considering that could further protect our community, further mitigate the spread of coronavirus, and let them know that we would be pursuing another meeting with them in the very near future. We also then, to follow that, met with the City Council and provided them as well with an informational briefing, which was really good. It was a great way for us to communicate and get the information out there to our policymakers, both Board of Health from a policy perspective as well as the City Council. As the Mayor indicated, we'll be meeting again with our Board of Health and our City Council tomorrow to further regard. And I got to just stop for a second and just say our Board of Health is just sometimes real time getting this information. You know, we had alluded to maybe a meeting in the next couple days, but right now I'm telling them, please look at your schedules for tomorrow afternoon because we're going to need a meeting with you. And I really appreciate their ongoing service to our community. They've been just phenomenal over the past couple weeks. But we are going to meet again, and we will consider what we can further do to make sure we mitigate the spread of the virus that causes COVID-19. I want to tell you also that we've been receiving questions about a state option to declare a public health emergency. We understand that the state can declare a state of public health emergency statewide, and we feel that that's something that we would like to hear more about, and we would like to understand at what point would be the triggers for them to declare a public health emergency. Because currently we are operating at the fullest extent we believe we are able to under current state law and executive order. So we hope more will be coming about that. Lastly, I just want to communicate that we are beginning to see some of the initial impacts of this virus in our community. We're seeing more and more information coming from our first responders and EMS, especially in relationship to the activities around being in quarantine. And so I'm going to say to you all right now that if you have been asked to be in quarantine, follow that notice from the health department, the State Department of Health. Follow that notice. If you are sick and you should be at home, be home and isolate yourself. These are two extremely important actions that you as a community must take right now to be ensuring that you are not spreading or have the potential to spread this virus in our community. To me, today, that is one of the biggest issues that we could possibly be having as we have more and more cases of disease of COVID-19 in our community, and more people that could be impacted by needing to be in quarantine to prevent the possible spread. So those are my comments for today, and I'd like to turn it over to Dr. Mike Wilde, CMO with Sanford Health.
Good morning, and thanks, Jill. Dr. Mike Wilde, Medical Officer for Sioux Falls Sanford Health. At Sanford, we are seeing positive cases of the coronavirus. We are also admitting patients to the hospital needing care, but also needing testing as well. What we've seen in the patients, what I've seen in the patients, is they are scared. Their family members are as well. They feel they've done something wrong. And rather amazingly, have been asked, and it really speaks to the passion of the people in this area, but they ask how they can stop the contagiousness from themselves. And so they're really thinking of all of us in the community. And it really gets to, everything that Jill just talked about and we've been talking about over and over again in regard to hygiene, distancing, et cetera. We're really trying to reduce the odds of transmission. We can't guarantee that things are going to spread. However, by doing those things, having thoughtful moments of hygiene, of hand sanitation, you can really reduce the odds of transmitting a case. We are currently testing at Sanford. That has had tremendous benefit in regard to the community, in regard to isolating those as appropriate for a lower amount of time versus also having people in the hospital requiring increased needs of personal protective equipment and exposure to staff and their family members. So we can reduce that amount of time. And if patients are testing negative, we can then continue the flow of the patients as we should through our hospital. Advice to the community is, again, to continue to isolate, as Jill pointed out, if you're ill. If you're ill and you feel you need further care, please call. Because through that call, we can direct care, which can protect the community, can protect the healthcare providers as well. So in calling, you may be directed to our drive-through testing facility. You may be directed to a video visit or an online visit of some platform, or you may be directed to our emergency department. But that way, we can best assure your safety, those you may interact with, and the healthcare provider safety as well. As alluded to as well by the mayor, the secondary effects of this illness, there's tremendous stress right now, not only with those affected, with those who are caring for them and their families, but also care workers at the hospital, in addition to those who have been laid off in the community. The normal flow of business is not occurring. We at Sanford do have mental health resources in all of our primary care clinics. We do have mental health therapists. We also have in and outpatient psychiatric and psychology care, and would encourage people strongly to access that. There's no harm in reaching out if you're feeling the need. And certainly through Sanford, through your primary care provider, you can rapidly access mental health resources in this very trying time. Sanford continues to prepare. We are prepared as an organization to provide the response we need to, but every day as that curve continues to flatten, every day that occurs, we continue to be better prepared. We're working tirelessly to provide a good response to this community and feel we have done so and are continuing and challenged to do that in the future as well. Actively working and appreciate the partnership with Avera, with city, with state and federal resources, and look forward to continuing with those relationships for the betterment of this community. With that, I'm going to turn it over to my colleague at Avera, Dr. Mike Elliott.
Hello, my name is Dr. Mike Elliott. I'm the Chief Medical Officer at Avera McKinnon Hospital here in Sioux Falls. I hope it goes without saying Avera is a very proud partner of this community. We fully support what the city of Sioux Falls and the mayor have done and are asking to be done. The precautions that they're taking to try to protect citizens of this community need to happen, and Avera fully supports that. We at Avera are focusing our efforts to be ready. We have and continue to build up our surge capacity. We are working diligently to maximize our mask, gowns, gloves, generically referred to as personal protective equipment. In fact, we've been able to increase our stockpile of that equipment from about 15 days up to 30 days through multiple efforts. As my colleague at Sanford alluded to, Avera has also developed in-house testing. We have been able to dramatically decrease the turnaround time from sample collection to results reported out. That allows us to better place patients within our hospital and within our community, and gives us needed information as we're tracking this illness. We have, as you know, a significant footprint much of it covered through e-care services, virtual care capabilities, and we are running that at full capacity to make sure that we can provide support through distance, virtual visits, both to limit exposure, but also to help those people that aren't readily available, have ready access to health care. As I hope you all know, we have done great strides to eliminate elective surgeries at Avera McKinnon at this point in time. Tomorrow we'll be stepping up to a higher state of triage within our outpatient clinics to further reduce routine visits, keep urgent visits as the priority in the clinics. Again, these efforts are focused at reducing the use of equipment, maximizing our workforce to be able to respond to a surge when it comes. You heard Jill Franken say this, my partner Dr. Wilde. I will reiterate it again. We cannot stress enough the ongoing and honestly increasing need for social distancing. Avoid large crowds. Take that 6 feet of distance between people seriously. If you're sick, by all means, stay home. Try not to spread this virus any further. If your symptoms are bad enough that you need health care, please call us first. Let us know you're coming. Let us be prepared for you. Let us have the opportunity to avoid unnecessary spread of the illness as you're coming into our clinics or emergency departments. We are in the process of rolling out a no visitor policy throughout Avera. Again, the reason for this policy is to do exactly what we're talking about. Improve our social distancing, protect our patients, the visitors that are there, our staff. Limiting the spread, flattening the curve of this illness is absolutely critical as we go forward. It's a tremendous honor to provide top quality health care to the people of our region. We, along with our colleagues at Sanford, with the great people of the city of Sioux Falls, are dedicated, truly dedicated to doing this before the pandemic, during the pandemic, and we will continue to do that after this is all said and done. Thank you. And I will pass it over to the mayor for final comments.
Thanks, Mike. All right, we'll open it up for any questions. A lot of moving parts today, so we'll certainly take any of those this time.
What is the punishment for Class 2 misdemeanor?
Class 2 misdemeanor, the question was the punishment for Class 2 misdemeanor. I think it's a $500 fine and up to 30 days in jail.
Mayor, with Sioux Falls, with 1,000 people now applying for within a week, when can those people expect the money, and what sort of qualifications go into getting the money?
Great question. The question was about the Sioux Falls Fund. When can people expect to have dollars out of that, and what are the qualifications to receive funding from that? As I mentioned, there's 120 families that are going to be getting funds this week, distributed from that fund. There's what's called an Unmet Needs Committee that meets and reviews all those and kind of prioritizes them based on the need, based on the story, based on the likeliness of eviction. That's our number one goal with that fund, is to keep people in housing, okay? And if people have exhausted every other option, they kind of rise up to the top of that critical needs list. As far as the criteria specifically they use, I can put you in touch with someone from the Helpline Center who leads the Unmet Needs Committee. I can tell you 1,000 plus entries, 1,000 plus stories that are there. It wrecks you. There are some tough situations out there, and we want to help everyone. I'm very thankful for the Fed relief package, which hopefully is providing some security to people today and some level of relief that they know there's support coming from the federal level.
Have you received confirmation as to whether community spread does exist within the city?
There will be a press conference that the governor will be having in an hour with more information on that. It's very likely that that has occurred, but we can't confirm that. So at 11:30, I think the governor and the State Department of Health will be able to provide definitive answers on that. And the question, I'm sorry to read back, was, has there been confirmed community spread in the city of Sioux Falls?
I'm sorry, you may have already said, did you give an estimate as to how much has been accrued in the One Sioux Falls Fund?
We're at about $1.2 million. There's a big response out of the gate. I'll be honest, it's flatlined a little bit because there's a little bit of trepidation and uncertainty in the economy overall. So businesses are saying, hey, before I give to this fund, I got to make sure I can take care of my own employees. And that's a very laudable and probably the right thing to do. So that's why I'll just continue to beat the drum and say, if you find yourself in a financial situation where you can't support the fund and you're wondering, how can I help, where can I give? That fund, a lot of nonprofits are great too. I'm going to continue to funnel people to that one.
So your ordinance that you're putting into effect, does that, or requesting put into effect, does that affect daycares, children care, anything like that?
So the question was, does the ordinance that we're asking our Board of Health to consider and then take to our council, does that include daycares, child care places, so forth? It does not. It does not preclude those from operating. It does not preclude health care, cafeterias from operating, places like that. So there are a list of what the exclusions would look like. Primarily, it's your restaurants, bars, cafes, video lottery, casinos, places like that, entertainment venues, recreational facilities. Great. Any other questions? All right. Thank you, everybody. Have a good